So the Ratchets and Wedges concept is a powerful model to help both clinicians and patients understand the fundamental drivers of upper quadrant dysfunction. So that is neck pain, shoulder pain, headaches, etc., etc. Picture a filing cabinet. If you tilt a filing cabinet forwards, what's the first thing that happens? The top drawer slides out. So we all notice the top drawer sliding out. We then think, well, let's push that drawer back in. So we push the drawer back in. The moment you take your hand away, the top drawer slides out again. So the position of the top drawer is directly related to the overall position of the cabinet. When treating patients, we can then get so caught up in what's happening in the top drawer that we miss the fact that the whole filing cabinet is tilted forwards. Now, we should be like an inverted pendulum, with the head moving around a middle balance point over the base of support of the pelvis and legs. All the time we spend in front of and over screens, what I refer to as the prevailing wind of the information age, means we spend most of our upright days in forwards and slumped postures. Over time, our bodies adapt to this position with joints stiffening and muscles and soft tissues shortening and tightening. Going back to the filing cabinet analogy, this is like a ratchet at the front of the filing cabinet progressively tightening down. This is the shortening of the muscles and soft tissues at the front of the trunk. And a wedge being progressively moved underneath the back of the filing cabinet. And this is the stiffening of the thoracic spine into a forwards bent position. So we're then in a situation where we've got a soft tissue tightening at the front and a joint skeletal stiffening at the back. These two forces then combine to keep our filing cabinet tilted forwards and the top drawer out and open. And when we spend day after day with the top drawer open, that causes an accumulation of stress and strain and mechanical irritation of the neck and upper back. The solution, therefore, is to release the ratchets and remove the wedges, enabling the filing cabinet to come back up into its upright and balanced and sustainable position, and repositioning the head from being forwards over the base of support back on top of the base of support. The OptiNeck Balance Wedge does this by changing our orientation to gravity. By getting gravity working for us rather than against us, we can then set about restoring the thoracic extension, so straightening out the spine, the mid part of the spine, which is effectively removing the wedges from the back of the filing cabinet, and by then opening up all the anterior myofascial chains that are shortening and tightening, so that's releasing the ratchets. It does it in such a way that is quick, easy, and effective, enabling the user to form a habit of regular postural correction. Change the habit, change the outcome.